Part of it.
BBC Radio Leicester.
14 minutes past 10 here on BBC Radio Leicester. Now, 5,000 British men go to the surgeon to alter their looks each year. Male plastic surgery, whether you like it or not, is on the increase, and the number of blokes going under the knife in 2015 was 4,614. That's according to the British Association of Plastic Surgeons. If you compare that with 10 years ago, the figure was just 2,440. So, what are men having done? Why the sudden rise? And would you ever undergo a procedure or surgery? I'd like to hear from you if you have had it done. Don't be too vain to give me a call or drop me a text. 81333 is the text number. Start your text message with the word Leicester. If you wish to give me a call, it's 0116 251 1049. If you're thinking about having something done, then also give me a call. I'd love to hear from you. But also your general views on men, and obviously women, you can get involved in this as well, but your general views on men undergoing the knife, undergoing plastic surgery. Well, with me in the studio is Graham Offer, plastic surgeon from Spire Hospital in Leicester, also works at other hospitals, including the LRI. Thank you very much indeed for coming in. I thought I'd make the effort this morning. I thought I'd better have a shave, I'd better use a good moisturiser so I don't look like, I should be sort of, lying on your surgical table somewhere, undergoing the knife. But how are you? Good to see you.
Nice to see you.
It's really the case, isn't it? More and more men are coming to people like you to change the way that they look.
Yeah, certainly there's been an increase, and it seems to be a year-on-year increase. Last year there was about a 13% increase across the board.
That's a big jump, though, isn't it? 13%. So that's quite a lot. What are people having done? What are they coming to you for?
Things like male breast reduction, so
Right.
man boobs, rhinoplasty, that's nose surgery, eyelid surgery, and contouring surgery after weight loss. There's been a lot of people losing weight, and then they need a tummy tuck to tighten up the skin, things like that.
And these are all procedures that men are knocking on your door for at the moment.
Yeah.
So
Yeah.
eyelids, I'm making a note here, because eyelids, I'm just checking my own here, eyelids, tummy, what was it, tummy tucks,
Yeah.
body contouring,
Yeah.
and man boobs.
Yeah,
Now,
and,
man boobs,
and noses.
and noses, of course. Yeah. So just explain what man boobs are for people who aren't so au fait with the term.
Man boobs, or gynecomastia, and what that is an increase in the breast tissue and the fat in a man, so that it happens generally at 2 times in life. So when boys are turning into men in their teenage years, they sometimes get some breast development, and some of those will then get a small gland of breast tissue, and often that will just resolve itself. But some men, it doesn't. So then they get into their 20s and they have a small breast, and it looks worse when they work out because the fat disappears and they're left with just a small lump, and they often come in for surgery.
And again, it's often to do with the look, though, isn't it? Because if they're wearing T-shirts or something like that,
sticks out.
Yeah,
and it's worse actually when it's warm because the nipple and the areola, the dark part around it, tends to it is a weaker point, so it tends to turn to almost like a dome, and they come in, and then the next time in life it happens is sort of middle age spread,
right.
And people put on a bit more fat around that area, and then they get a similar appearance.
Noses. Now, why noses? I mean, most people's noses are fine, aren't they? I mean, you don't sort of go around going, crikey, look at the nose on that, crikey, look at the nose on that.
I think it's just the extremes, really. I think with
people with like a longer nose or a broken nose or something like that.
Broken noses definitely, but also like people with very prominent dorsal humps, or the bridge, you've got a big bump on the nose. People don't like that.
And is that the one where we've seen the scenes where you go in with the chisel,
osteotome? Yes,
and that's it. You actually bang away and
you have to
tape it down.
There's different ways of reducing the bony excess. So you can use it like a little rasp, which is like a little.
Like you would in woodwork when you were a kid.
Yeah, very,
to just
very
smooth off a
but
surface.
But obviously
on bone.
Yeah, similar. But obviously smaller, finer instruments. And then chisels, which are to take off extra bone, or osteotomes, which are a similar sort of piece of kit, but they're more like 2 millimetre in diameter rather than your thing.
Big old plane sort of thing, yeah. It is interesting that more and more men are quite self-conscious about their bodies. And we've seen for a long time women feeling self-conscious, and still do. And a lot of that is media and how women are portrayed in media, how women are made to look. And there's been a big increase in certainly the number of teenage lads, for example, that are getting into sort of bodybuilding and taking body dysmorphia, having real issues around that, again, because of how men are portrayed in media. Is that, when people come in, do they say, I really want this for me, I really want to feel better, I want to have my body reshaped? Or do they bring in like a picture and say, you see that man there in that magazine, I want to look like him, I want to have abs like that, I want to have pecs that look good and things like that?
Well, in Leicestershire, no, more the first patient that you described. So the patient that's having, they don't like the way they look for a particular reason, and then you have to explore as to why that is. Are they having functional problems, like with the gynecomastia, the man boobs? Often it can be quite painful. So when they turn over at night, it wakes them up, they get pain in it, and things like that, and they can get some swelling in there. So they come in for that sort of reason. I don't really see people, the second person that you described, with saying, look, I want to look like that. But certainly, I'm sure over the last few years there is more pressure on men to look better, as there is on women. I think there's. You have to watch that. I think it can be quite unhealthy in its extreme, and some of the celebrities are just
to blame. Yeah, absolutely. People look at them and they think, well, hang on a minute, I really want to look like that. Have you, again, you're mixed? Do you do a mixture of private and also NHS work?
Yes, I do. Yeah,
and the NHS. I mean, people sort of say about you often hear these stories of somebody who had a boob job on the NHS, but it's not quite as straightforward as that, is it? The NHS only
no. I mean, maybe 15, 20 years ago when I was in my training as a registrar, yes, we used to offer quite a lot of what is now classed as sort of cosmetic, so that we even down to tummy tucks, breast augmentation, occasionally breast reductions. But a lot of that has now stopped. It was all done on psychological grounds, but the current climate that virtually non-existent.
Yeah, but you've got people on waiting lists for new hips and stuff.
Yeah,
you
exactly.
Can't really be,
I think there were various.
Up,
There's been lots of national initiatives looking at the sort of evidence base for which the public should pay for. So for example, a lady with extremely large breasts, and there are certain guidelines as to how big, and say she's getting backache and neck ache and getting problems with the posture, then that may be available on the NHS for selected people. But if the breasts are just want to be a bit lifted and made a bit more pert, that's obviously more cosmetic, so that wouldn't be allowed in the NHS, and that would be...
It's really interesting. I want to talk some more with you. We're going to have a bit of a music. This is Adele and Rolling in the Deep, and if there's anything you want to know about plastic surgery, and indeed if you've ever had it done, do give us a call, 0116 251 1049. More with Graham Offer, consultant plastic... I'm in trouble with the word consultant today, I don't know why. Consultant plastic surgeon from the Spire Hospital in Leicester. Rolling in the Deep and Adele. 5,000 men undergo plastic surgery in a year, or roughly about that. It's 4,614 according to the British Association of Plastic Surgeons go under the knife, but around 5,000 people go to their surgeon. They want to look different. We've been asking why Graham Offer is consultant plastic surgeon from Spire Hospital here in Leicester, also works at the LRI and other hospitals in the county. And Graham, you were talking about body contouring, and this is the idea of you're basically reshaping someone's body. And a lot of people want to be thinner than they are. They want to look better than they are. They might want to have fat removed. But your advice, first and foremost, is try and lose the weight naturally first before you'd have anything done, is it?
Absolutely, yeah. Because it will reduce the risk of complications at the time of surgery. And, of course, if somebody's reached a target weight that they're then going to hopefully stay at, then you can tighten up everything to fit them at that weight, if you see what I mean. Otherwise, if you do it before they've lost the weight, it would be much more risky of having complications, and obviously if they then lose weight later...
Well, the body to a certain extent would all be out of shape, wouldn't it? Because you do tighten all the tummy, but then the bum would sag, and then you'd have the sort of the back of the thighs or whatever, whereby you might want to. You can tell I've looked a lot at this. As someone who's gone up and down in weight before. Regulation's a big thing. I mean, you're here. We wouldn't have got you on, of course, without... making sure that you were accredited, making sure that, and obviously, you're local, you work locally, you're known. But, I went on Well Known Search Engine today and indeed yesterday to do a bit of research into male plastic surgery, and the number of ads offering you treatment, literally just saying sign up here, come and have a consultation. You've got to be really careful who you go to with this, haven't you?
Absolutely. I mean, I think this has been a problem for a number of years with the lack of regulation, really, and unscrupulous people, taking advantage. And I think, at the minute, there's a lot. It's after several reports, government reports. We're now at the level where we have a cosmetic surgery interface group at the Royal College of Surgeons, which is looking into making out new standards and what we call some forms of accreditation that will reassure the public. Okay, so people will have to be certified in particular things, in particular aesthetic procedures. Okay, and that will be hopefully coming online later this year. Well, around now and later this year.
Yeah, absolutely.
But what people can do, I mean, if they really are concerned, that you make sure they go to see someone who's properly trained in plastic surgery. So, for example, go to the BARP's website, the British Association of Aesthetic Plastic Surgeons, the BAAPS website, and there's a list of surgeons that are all NHS trained and UK and regulated, and that would be a reasonable starting point. And make sure they're on the specialist register. The General Medical Council have a specialist register listing surgeons in different specialties.
Yeah, absolutely. Can I ask about things like this? Because we're hearing about the rise of non-invasive plastic surgery. This is where you wouldn't necessarily use a knife and lasers and all this kind of
non-surgical stuff.
Non-surgical stuff.
You like chemical peels for the skin?
Yeah, where it starts to end up being much more of a kind of you want to look good as opposed to a drastic change or whatever. I mean,
there's been a massive increase in this.
Does that include Botox even?
Yeah, exactly. And I think for years people have been trying to get rid of certain lines or sort of small, mainly lines, say forehead lines, and there's nothing that you can spend hundreds on creams and they don't really do that much. Yeah. But if a little bit of Botox to paralyse the muscles and a bit of filler, and suddenly it works. Okay, so people have got quite into this, and again, this is an area that's unregulated. So you don't. You get the situation now where you get people who have no medical training at all, just injecting, and you could be lucky, you could be very unlucky. And it also
it goes quite badly wrong, doesn't it?
It can do, yeah. I mean, the big problem is with fillers that and things like that, which are permanent, because they go into the face, say, and then if they're slightly in the wrong place or something goes wrong with them, well, how do you get them out? They're permanent.
Yeah, that's the thing. Yes, once they're
this can be a real problem. So again, there are things in motion now looking at to try to regulate this a bit more.
What about pricing? Has pricing come down? I mean, if you wanted to have something done, I mean, is it still something that people have very much to save up for, or it's still something that?
Yeah, I think it's become more affordable as the acceptability of it in our society, where people are accepting of people to have this. 20, 30 years ago, people didn't talk about it like they do now. There were always people having it done, but
20 or 30 people were like, oh gosh, she's had a bit of work done. And people still say that to a certain extent, but actually it's much more. People would actually think, do you know what? Maybe I would consider having something.
And I think things are changing. I think certainly, for example, if I do a breast augmentation in a lady, so breast implants, a lot of women now want the more natural look that's in proportion to their figure. Maybe just to bring them back to the figure that. Like for example, if they've had children and the breasts have really shrunk, they want to go back to looking as they used to. It's not necessarily people that have always wanted to look different. It's people that have just changed and they want to look like they always used to look. And they don't want to look like a massive and abnormal with huge breasts. They want to look so that people almost don't notice they've had it done. They just think they look good.
Is there? I mean, I guess with your work as well, there's a level of care and also a level of when you're thinking about mental health as well, people's own sort of mental health when it comes to their own how they perceive themselves. Because there must be a point as a surgeon where you think, actually, do you know what? You really don't need to have this done, or you possibly are getting a bit addicted to this?
Yeah, I mean, you do get people who you can see have obviously got lots of psychological issues, and yes, surgery may not be the way forward for them, and I think it is important to notice that. You also get people that have psychological issues, but surgery would help them.
Yes.
And so it's making the decision, and often it may involve a clinical psychologist or somebody, and just treat the patient with respect and try and come to find out what what you can do to help in the best way.
Well, I mean, as we say, it's a growing market. More and more men are having it done, and as you say, there's no sign at the moment that that's set to slow down. So it's very interesting indeed, very interesting. And I think I'm all right at the moment. But Graham did just show me what they do if they do a tummy tuck and how the procedure works. So I don't know. I'd have to be quite brave for that. Probably save up quite a bit, I'd imagine. I think probably just get down the gym and eat less cake and drink less wine is probably a good option to start off with. Lovely to see you as always, Graham. Thank you very much indeed for coming in. So if you want to talk to me about plastic surgery you've had, or are you thinking about having something done, or maybe just don't get it, maybe it's not for you, you can always, whatever your view, get in touch with me this morning. 0116 251 1049.
BBC Radio Leicester.